Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. Friends, August first week has been celebrated as World Breastfeeding Week. So, in this relation, one of the theme of this year, that is breastfeeding challenges of working mother and its solution. So this has been given as theme for the year 2023. So, this being the case, in this breastfeeding week, we shall have a discussion on challenges of a working mother as far as breastfeeding is concerned and also its solutions. So, we shall discuss on this particular matter. Okay, now when we talk about breastfeeding has been considered as a right of the baby. You cannot deny the right of the baby. So, breastfeeding has got multifaceted benefits. It has got multifaceted benefits to the baby. It has also got the benefit to the mother. It also has got benefit to the father, and it also has got benefits to the society. So, this being the case, so breastfeeding should not be denied to the baby. Meantime, breastfeeding is the one which gives the feeling of motherhoodness to the mother. Now, this particular feeling is very important. Then only the mother feel herself complete. So, this particular feeling has been given by the breastfeeding, the maternal bonding that develop when mother is feeding the baby with the exchange of visual ideas and the emotional factors between the baby and the mother during the time of breastfeeding is not explainable, rather, it is experienceable. So, this is a very special feeling to the mother, and this makes the mother very complete. Similarly, this is the one which gives the a feeling of satisfaction. Breastfeeding mother always gets satisfied because she has got a feeling that she has rendered her responsibilities or duties. Meantime, as we have discussed, breastfeeding has got multifaceted benefits, beneficial to the baby, beneficial to the father, mother, and also the society. And more than that, breastfeeding is considered as one of the great investment. Instead of investing anywhere else for the baby in terms of money, instead of investing the money in the name of the baby, breastfeeding itself is the main investment. Why I mean to say is, if you are giving proper breastfeeding as far as possible, maybe up to 2 years, then definitely IQ of the baby will be at a higher level. When the IQ of the baby is at the higher level, not only in the academics, even in the general life activities also, child shows higher levels, and that is a great investment. Similarly, immunity, breastfeeding provides the immunity. Now, you have to waste so much of money for the disorders of the children. You have to treat diarrhea, you have to treat some infectious disorders, etc., and you need to spend a lot of money for that. Instead, if you are going for breastfeeding to your child, the immunity of the child will increase, and as well as the child will be suffering from very less disorders. This is a big investment. Similarly, there is no sickness. Now, biggest investment is if you are giving breastfeeding, feeding the baby with the breastfeeding, then in future some of the lifestyle disorders like diabetes mellitus, lifestyle disorders like the hypertension, lifestyle disorders like obesity, and so many other autoimmune disorders. So the incidence of these disorders is very less, and this is the biggest investment. Health is the biggest investment that you can offer to your baby. Okay, so in the later part of the life, you're offering a healthy life to the baby in the second part of his life, and that is the biggest investment. Similarly, emotional relationships, see, this is unexplainable. The relationship that a baby develops with the mother, father, and other family members, okay, so this is unexplainable, and this is very valuable also in the present context. The love, affection, concern, and as well as the attachment that the baby developed with the mother and as well as father and other family members. So this is made possible by rendering the breastfeeding. This is also the biggest investment. So when we are old, if our children are not looking after us, and then it is a very sad thing. So make your old age secure. You have to breastfeed now because that helps to develop a strong emotional relationship. A child who developed a strong emotional relationship with the family members or mothers, so definitely he will look after her mother and father in his or her old age. So there are multiple benefits like this regarding the breastfeeding. So mother who breastfed the baby will also have the great esteem, and one more investment is even the mother is also having less chance of developing breast cancer, uterine cancer, cervical cancers and obesity, etc. So these are all the benefit of breastfeeding. With having all these benefits, there is no meaning in denying the breast milk to the baby. So what I mean to say is breastfeeding is not only nutritional, breastfeeding is a multifaceted phenomenon. It has got number of benefits. So therefore, it is a right of the baby and that should be given to the baby, and it is equally helpful to others also. Now, in India, especially, we go into the government policy. As far as working mother, we are discussing about this burning problem in relation to working mother. How a working mother can continue breastfeeding even after her maternity leave. Okay, so government gives 6 months of maternity leave. Okay, now first 6 months of the life in the baby, that's called as period of exclusive breastfeeding. Exclusive breastfeeding, only breastfeeding should be given to the baby, not even the water, except some of the medication. So that is the definition of a exclusive breastfeeding. So in India, government gives 6 month maternity leave for every mother. Okay, after delivery. See, India is so aware of breastfeeding and given such a facility to render the breastfeeding. But if you go to some of the foreign countries, even in the US, there is no such maternity leave, etc. So India is too forward from these countries as far as breastfeeding matter is concerned. Okay, so India is better than many of the other countries regarding the breastfeeding awareness. But problem is in some of the private sectors they will not allow the 6 month of maternity leave. There may be different reasons. Okay, so sometime the private sector may be very rigid, or sometime the mother herself has got some helplessness and she has to go to the duty at the earlier itself, and mother has got some economical problem, or mother also has got some insecurity problem. Suppose if she is not going to the duty, they will employ some other personnel there, so she may lose the job. So these insecurity factors are also there. So because of all these factors, private sectors, it is not properly implicated, private sector. Okay, otherwise in all the government sectors we have 6 months of maternity leave. Anyway, so government has well focused on this and it has given all the relaxation. Okay, and now for example, I recently read in the paper where Sikkim government, I think so, they have given 1 year of maternity leave. Okay, that's a good thing. Now, uh, breastfeeding should be given to the baby. Everybody knows because 5,000 years back, Kashyapa also told, Matureva Pibestanyam. Ayurveda Samhitas also told, Matureva Pibestanyam. The only breastfeeding should be given to the baby in the first 6 months. It has been told 5,000 years back. But even today, we are not completely following it. Now, why we are not following? So most of the time, people say the uneducated people, they don't know. See, this is a wrong notion again. Uneducated people, so-called uneducated part of our populations, so they are giving the breast milk to the baby. The people who are not, or people who are denying the breast milk to the baby is educated. This is very disappointing thing. If you go to the village area and if you talk to a village lady who is a daily worker, okay, so or maybe a housewife, and she was so well aware of the breastfeeding and she never denied breastfeeding to her baby. But if you talk about the working mother, or if you talk about the urban population, or if you talk in educated sector, so then they have got so many wrong informations and misconceptions. Okay, so this is not the problem with uneducated. Actually, this is the problem with the educated or wrongly educated or half educated. This is a basic problem. Okay, so they have got so many misconceptions. If I am breastfeeding, my body figure will going to be lost. Exactly opposite to that occurs. If you are feeding your baby the extra fat which is present in your body, so that will be burnt out and you will get a good figure, and you don't have the risk of obesity in future also. Not only obesity, diabetes, etc. Okay, and uh, the breastfeeding, that means baby will be habituated for that. No, these are all the part of the life. You have to give the breast milk to a particular time of the life, and then gradually you have to withdraw it. So like this, the educated will have so many reasons, so many um, um, the causes, so that they stop breast milk. Okay, so I am going to work, how can I feed the baby, therefore I have to stop the feeding now only. Okay, so I didn't get the time. Okay, and then so I am in a particular sector where my body figure is very important, so I want to maintain it. So like this, so many wrong notions are there. So therefore, this is basically a problem with the working women, or basically a problem with half educated or wrongly educated people. And for my surprise, I have seen many times uneducated people blindly they will give the breast milk. They don't know the other things, but one thing they're very clear in their mind, that breast milk should be given to the baby, and they will give it as far as possible. Okay, in the government sector, to solve this problem, we can do one modification. So usually in the government sector, they will go for antenatal leave also in the last few months of the pregnancy. So if you are able to do the work there, so you can reduce the antenatal period leave, and you can add it on to the postnatal leave, that is maternal leave. Suppose in the after seventh month, if you are going on leave, instead of after going in the seventh month, you can you can increase, stretch it up to 8 month, and that 1 month can be added for the maternity leave, and so that up to 7 months you are feeding the baby. So this type of modification can be done up to certain extent. Now, this is the first part of this series of lecture related to breastfeeding, a challenge of the working mother. In the next class, again, we will continue the same. Thank you very much.